You are standing in front of the mirror and you notice it again. The part in your hair looks wider than it did last year. The ponytail that used to be thick enough to fill your whole hand now wraps with room to spare. The shower drain tells the story every single morning. Clumps of hair that used to stay on your head are now circling the drain, and nobody seems to have a real answer for why. Your doctor told you it was just aging. The shampoo commercials sold you volumizing products that did absolutely nothing. Maybe you even tried biotin gummies for a few weeks and gave up when you saw no difference. And through all of it, the thinning kept progressing quietly, steadily, in a way that is genuinely affecting how you feel about yourself every single day. Here is what nobody told you. In the majority of women over 65 experiencing significant hair thinning, the root cause is not aging itself. It is a specific pattern of nutrient deficiencies that develop silently over years, that standard blood panels almost never catch, and that is almost entirely correctable once you know what you are actually dealing with. I am Dr. Steven, and this channel exists to bring you the latest peer-reviewed research on senior health translated into clear, practical information designed specifically for adults over 60. If you have not subscribed yet, please do that right now because what I am covering today could genuinely change what you see in that mirror within the next 3 to 4 months. Let us start with what is actually happening inside your hair follicles, because once you understand the biology, everything else makes sense. Why hair changes so dramatically. After 65. Each strand of hair on your head grows from a tiny structure called a follicle. That follicle goes through 3 phases: a growth phase called anagen, a transition phase called catagen, and a resting phase called telogen, where the hair is released and falls out before a new strand begins growing. In a healthy scalp, roughly 85 to 90% of your follicles are in the growth phase at any given time. After 65, several things happen simultaneously. Estrogen levels, which support the growth phase and keep follicles active longer, have dropped significantly. Blood circulation to the scalp decreases, which means the nutrients your follicles depend on are arriving in smaller quantities. Cellular turnover slows throughout the entire body, and hair follicle cells are among the most rapidly dividing cells you have. When that division slows, follicles shrink, produce thinner strands, and spend more time in the resting phase. Here is the part that matters most. Every single one of those biological processes depends on specific nutrients to function. When those nutrients are low, the entire system degrades faster than it ever would from aging alone. Aging creates vulnerability. Nutrient deficiency is what turns that vulnerability into visible, accelerating hair loss, and the research is unambiguous about which deficiencies are most responsible. Deficiency. Number 1. Ferritin, the iron storage problem. Nobody is checking. Most doctors check iron levels through a standard blood test, but standard iron tests measure circulating iron, the iron currently moving through your bloodstream. What they almost never check unless you specifically ask is ferritin, which is the protein your body uses to store iron in your tissues. Here is why this distinction is critical. Your body is intelligent about priorities. When iron is running low, it pulls stored iron from ferritin reserves to keep your vital organs functioning. Your heart, your brain, your liver, they get the iron first. Hair follicles are considered non-essential by your body's triage system. They are last in line. So a woman can have a normal circulating iron reading on a standard blood panel and simultaneously have ferritin levels so depleted that her hair follicles are essentially running on empty. A landmark study published in the Journal of Investigative Dermatology analyzed ferritin levels specifically in women experiencing non-scarring hair loss and found a clear, consistent relationship between low ferritin and accelerated follicle miniaturization. The researchers concluded that ferritin levels below 40 nanograms per milliliter were significantly associated with hair thinning, even when standard iron levels appeared normal. For context, many laboratories flag ferritin as deficient only when it falls below 12 or 15. That means a woman with a ferritin level of 20 could be told her iron is completely fine while her hair follicles are starving. After 65, ferritin depletion becomes particularly common because stomach acid production decreases with age, and adequate stomach acid is essential for absorbing iron from food. If you have also been on a proton pump inhibitor, medications like omeprazole or Nexium for any extended period, that acid suppression accelerates the problem significantly. I want you to comment below right now. Have you ever had your ferritin level specifically tested? Not just your iron, but your ferritin? Yes or no? I want to understand how many women watching this have actually received this test, because the gap between who needs it and who gets it is genuinely alarming. Deficiency number 2, vitamin D, far more than a bone nutrient.
Most women over 65 have heard that vitamin D matters for bone health. What almost no one has been told is that vitamin D receptors are present in every single hair follicle on your scalp. This is not incidental. Vitamin D plays a direct and documented role in regulating the hair growth cycle, specifically in stimulating follicle cells to move from the resting phase back into the active growth phase. When vitamin D is deficient, follicles get stuck. They spend longer in the resting phase, produce new growth more slowly, and the strands that do emerge are thinner and more fragile than they should be. A 2019 study published in the International Journal of Dermatology examined vitamin D levels in women with female pattern hair loss compared to women without hair loss in the same age group. Women with significant hair thinning had measurably and substantially lower vitamin D levels than the control group. The relationship was consistent across the study population, regardless of other variables.
And deficiency in this nutrient is extraordinarily common after 65 for a straightforward biological reason. Your skin produces vitamin D when exposed to sunlight through a chemical conversion process. After 65, that conversion becomes significantly less efficient. The same amount of sun exposure that produced adequate vitamin D at 40 produces roughly 25% of that amount at 70. Combined with the reality that many older women spend more time indoors, wear sunscreen appropriately, and live in northern climates with limited winter sun, vitamin D deficiency in this age group is nearly universal without supplementation. The optimal range for vitamin D when it comes to hair health appears to be between 50 and 80 nanograms per milliliter based on current research. The standard sufficiency threshold most laboratories use is 30, which means a woman could test at 32, be told she is perfectly fine, and still have levels too low to support healthy hair follicle cycling.
Deficiency number 3, zinc, the follicle repair mineral. Zinc is involved in over 300 enzymatic processes in the human body. For hair specifically, zinc plays 2 essential roles. It supports the structural protein synthesis that builds the hair shaft itself, and it regulates the oil glands surrounding each follicle, which help protect the follicle opening and maintain the environment where healthy growth occurs. When zinc is deficient, hair shafts become structurally weaker and break more easily. Follicles become inflamed at a subclinical level, meaning there is no visible redness or obvious irritation, but a low-grade inflammatory process that gradually damages the follicle's ability to produce strong, consistent growth. A comprehensive review published in the journal Dermatology and Therapy examined zinc levels across multiple studies of patients with various types of hair loss, and found that zinc deficiency was consistently more prevalent in hair loss patients compared to control groups. Supplementation in deficient individuals showed meaningful improvement in hair density and reduced shedding in the majority of cases studied. After 65, zinc absorption decreases for the same reasons iron and vitamin D do: reduced stomach acid, slower gastrointestinal function, and the cumulative effect of years of dietary patterns that may not have prioritized zinc-rich foods. Certain medications extremely common in older adults, including ACE inhibitors for blood pressure and diuretics, also increase zinc excretion through the kidneys. Let me tell you about a patient I will call Eleanor. She was 68 years old, a retired accountant, sharp and meticulous about her health. She ate what she genuinely believed was a balanced diet. She exercised 3 times a week. She took a standard multivitamin every morning. But over about 2.5 years, her hair had thinned so dramatically that she had begun wearing her hair differently every day specifically to conceal it. She was avoiding social situations because of her self-consciousness and had quietly stopped attending her weekly book club. When I reviewed her actual nutrient levels through comprehensive testing, her ferritin was at 18, her vitamin D was at 29, her zinc was borderline low at the bottom of the reference range. Her standard blood panel, the one her previous doctor had reviewed and called completely normal, had not flagged a single one of these values as problematic. We built a targeted supplementation protocol and made 2 specific dietary adjustments. At her 4-month follow-up, she brought photographs. The regrowth along her hairline was visible to both of us. She returned to her book club the following week. Deficiency number 4, protein and the amino acid. Most women are missing. Hair is made almost entirely of a protein called keratin. Keratin is assembled from amino acids, the building blocks your body extracts from dietary protein. After 65, protein requirements actually increase compared to middle age because your body becomes less efficient at extracting and utilizing amino acids from the food you eat. The current recommended dietary allowance for protein, which is 0.8 grams per kilogram of body weight, was established for younger adults. Leading geriatric nutrition researchers now argue that adults over 65 need closer to 1.2 to 1.6 grams per kilogram of body weight daily to maintain muscle, organ function, and yes, hair follicle health. One amino acid in particular deserves specific attention for hair growth: lysine. Lysine is an essential amino acid, meaning your body cannot produce it and must obtain it entirely from food. It plays a direct role in iron absorption in the intestines and is involved in collagen production, which forms part of the structural foundation of the follicle itself.
Research published in the journal Clinical and Experimental Dermatology found that women with hair loss who had adequate iron levels but low lysine intake showed significantly less response to iron supplementation alone. When lysine was added, the response improved substantially. This suggests that lysine deficiency can block the effectiveness of other interventions you might already be trying. Lysine is found primarily in animal proteins, particularly red meat, poultry, eggs, and dairy. Women who have reduced their animal protein intake for health or digestive reasons, which is extremely common after 65, are at meaningful risk of lysine insufficiency even if their total caloric intake seems adequate. Exactly what to do. Starting this week. Here is the precise, practical protocol based on everything the research supports. First, request specific laboratory testing at your next appointment. Ask your doctor for ferritin, not just iron or hemoglobin. Ask for 25-hydroxyvitamin D, which is the correct test for vitamin D status. Ask for serum zinc, and ask for a comprehensive metabolic panel that includes total protein and albumin. Write those exact words down and bring them to your appointment. Second, for vitamin D supplementation, most women over 65 benefit from 2,000 to 4,000 international units daily, taken with a meal containing fat because vitamin D is fat-soluble and requires dietary fat for absorption. Take it with breakfast or lunch rather than in the evening. Third, for ferritin support, if your ferritin comes back below 40, ask your doctor about iron supplementation. Ferrous bisglycinate is the form best tolerated by older adults with the least gastrointestinal irritation. Take it with vitamin C, even just a small glass of orange juice, which significantly improves iron absorption. Never take iron and calcium supplements at the same time, as calcium blocks iron absorption. Fourth, for zinc, a daily supplement of 15 to 25 milligrams of zinc picolinate or zinc bisglycinate is the best absorbed form. Do not exceed 40 milligrams daily without medical supervision, as excessive zinc can paradoxically interfere with copper absorption and cause its own set of problems. Fifth, increase your dietary protein deliberately. Aim for at least 25 to 30 grams of protein at each main meal. Eggs, Greek yogurt, salmon, chicken, and legumes combined with grains are all strong sources. If meeting protein targets through food is genuinely difficult, a high-quality whey or collagen protein supplement can fill the gap. Sixth, be patient and consistent. Hair follicles operate on a cycle that takes time to shift. Most women see a reduction in shedding within 6 to 8 weeks of correcting underlying deficiencies. Visible regrowth and increased density typically require 3 to 6 months of consistent correction. The research is clear that these changes happen, but they do not happen overnight. A critical safety note before we close. If you are currently managing kidney disease, please discuss iron and protein supplementation with your nephrologist before making changes, as both require careful monitoring in that context. If you are on blood thinners or medications for heart rhythm, discuss zinc and any new supplements with your physician first. And if your hair loss is sudden, patchy rather than diffuse, or accompanied by scalp pain, scaling, or redness, please see a dermatologist promptly, as these patterns can indicate conditions that require different evaluation entirely. What you see in that mirror every morning does not have to keep getting worse. The biology of hair follicles after 65 is genuinely responsive to nutritional correction. Ferritin, vitamin D, zinc, and adequate protein are not exotic interventions. They are fundamental nutrients your follicles have been waiting for. Comment below with your age and which of these 4 deficiencies you suspect most applies to you. Comment testing if you are going to request these labs at your next appointment. And if someone you love is quietly struggling with the same thing and blaming age for something that may be entirely correctable, please share this video with them today. I am Dr. Steven. Subscribe if you have not already, because next week I am covering the one breakfast habit that research now links directly to accelerating hair loss in women over 60. It is something most people consider completely healthy, and it is in the majority of kitchens right now. You will want to know before your next morning meal. Take good care of yourself.